Hello guys. Health insurance for non-citizen foreigners and immigrants part 2. The standard of medical care in the United States is high compared to its neighbor. Thus the higher cost associated with it aside from this public care is provided only to a portion of the population. This is why most people including the local have private health insurance coverage in America. The federal Medicare program is available only to retirees. The Medicaid program, on the other hand, is reserved for the poorest citizen in the country. If you are expatriate in the U.S., you will not qualify for either of these programs. Your employer will usually give insurance that extends coverage to immediate family members. However, this is often too this is often not enough to shoulder the cost of the expensive healthcare service in the country. As with most immigrants, it is highly recommended that you purchase international health insurance to make sure you are protected in immediate emergencies. Immigrants in the USA, according to US custom, to obtain an immigration visa, you must show proof that you are covered by an approved health insurance provider. Fam- family or family or employment based policies are usually the type of plan accepted. The policies should be valid within 30 days of entering the US territory unless you have proven that you have enough money to cover any for accessible medical costs. Health insurance for foreigners in the USA and the ACA penalty. The Affordable Care Act, also known as Obamacare, details the shared responsibility provision. Its goal is to make sure all US citizens and permanent residents have access to quality and affordable health insurance in America. Non-resident, including international students on the FJM and Q visa category, are not subjected to the individual mandate during the first 5 years of their stay in the country. For individuals in the J category, including teachers, trainers, and AU pair students and travelers, the ACA states that they are not subject to the individual mandate for 2 years. Beginning with the 2019 plan year for taxes filed in April 2020, the ACA or shared responsibility payment will no longer apply. Details foreign nationals who live in the US for a short period that they do not become resident alien for federal income tax purpose are exempted from the individual shared responsibility payment even though they may have to file for a US income tax return. The IRS discussed in detail when a foreigner becomes a resident alien in the US for federal income tax purpose. Individuals who are exempt under this rule are non-resident alien, dual status alien who are in their first year of residency in the US, non-residents alien or dual status aliens who choose to file a joint return with a US spouse, individual who file a Form 1040 NR or Form 1040 NR EZ, including a dual status tax form, a tax return for their last year of stay in the US as a residents, and individuals who are valid for the personal exemption on Form 1040 NR or Form 1040 NR EZ. All US citizens living in the country are subject to individual shared responsibility provision. All permanent residents and foreign nationals who have been in the United States long enough during a calendar year to qualify as resident alien for tax purposes are also covered by provision. The category include non-resident aliens who meet certain presence requirements, and elect to be treated as resident aliens. For more information, see pub.5919. More shared responsibility from the IRSC question 11. Thanks.